Hello, everyone. I am Xuanan Cao.
And I'm Rusbeh Youssefzadeh.
Should AI models report to us when they are clueless? Assuming that we know AI is often used in automations, it means that they make decisions and predictions. Sometimes they do that beyond their knowledge, which means they make predictions beyond the training set from which they have learned. In other words, they can be clueless. The question is, should they report that? What have we been doing?
So in the past few years, there has been many efforts about regulating and legislating the use of AI models, especially in high-stake decision-making. Examples of these efforts include the AI Act and the GDPR in the European Union, and also the National AI Initiative in the United States. Through all these efforts and all these discussions, a consensus has emerged that there is a right to receiving some explanation of automated decision-making for people who are affected by those decisions. We believe that an important and fundamental piece of information has been left out in these discussions about explainability, and that piece of information is related to extrapolation.
What does extrapolation mean?
So extrapolation is a geometric concept in mathematics. Imagine that we have a set of data points that we are going to train an AI model. And those data points comes from this region of the world. And if we have our domain is this 2D domain, which we see on the map, we can form a convex body of the data points that we have received, which would be this black line. And the boundaries of this convex hull would mark the limits of our data set. So any point that we receive that falls outside these boundaries would require the AI model to extrapolate. This is basically our extrapolation. We believe that whenever an AI model has to extrapolate, it receives a point that falls significantly outside this range, these limits, it should be reported. Shannon, can you give us an example of extrapolation?
Yes. Bob is our patient in a hospital. A nurse comes to his bed. Bob has features that nurse has never seen before. Those includes his physiological features such as age and blood measurement. The nurse has not seen patients with exactly those features. What would be the nurse's reference point? The nurse has education and seen a lot of patients in his lifetime, but that doesn't even come close to Bob. Luckily, this is a medical facility, and it happens to have over 1 million patient records. So if the nurse has the will and time to go over those 1 million records, what would happen then?
Good question. If he has the will and time to actually do that, he might still not find any patient information close enough to Bob's. But also let's assume that the nurse has access to some computer program that can compute the convex hull of all the patient information for that more than 1 million patient records. And he would be able to, using that program, he would be able to find the closest combination of many patients' information that would come even closer to Bob's. We actually did that. We actually did that for a medical facility, the data set there, and we came out to this data point.
I can see that Bob is quite different in terms of blood measurement. So the nurse would not be confident to extrapolate. Instead, the nurse would probably go to a physician and go from there. Now, imagine instead of the nurse, an AI model trained by all the over 1 million records makes the recommendation. What should the AI model do when extrapolating for Bob? Bob is still considerably outside the convex hull, so the answer would be like the nurse. The AI would say, "This is not something I've seen before. I am extrapolating. Please take a look." In the current model, we do not distinguish a typical patient from a patient laying outside a convex hull when the model has to extrapolate. So the reality is that the AI is still making a decision without reporting anything.
Yes, the AI model makes a decision nevertheless. And we see that Bob is not just a rare case. This happens frequently enough, maybe for 15% of patients. And we also see that this is not just for medical applications. This happens frequently for many other applications of AI.